Just waiting for Kevin. There he is.
Hello. Hello.
What's up?
Happy Thursday. How are you doing?
I'm good. How are you? This weather's been great today.
I know, right? It's definitely on the warmer side of things, which we love. You can almost feel like summer's just around the corner, huh?
No, I'm looking forward to it.
I'm just trying to pin the comment here. I think I might go out for a little bit. BRB. And I'm back.
And
Sorry
he's
about
back. Wow, welcome back.
All right. Well, Tommy, thank you for having me here on this virtual space again. For those of you tuning in, my name is Kevin Jordan Contreras, he, him, and I work with Tommy at Whitman-Walker in Community Health.
Yep, and hi everybody. I'm Tommy Sanchez, pronouns he, him, his. I work with Kevin at Whitman-Walker in the community health field.
All right. So let's talk about Mpox updates. And we're also talking about other things relating to sexual health today, which I'm excited about.
Yeah.
So once again, quick spiel as always. During the COVID-19 pandemic, we shifted towards doing internet outreach and social media live, such as this one through Instagram, where we talk about different topics of conversation, including Mpox, like we are doing right now, but we also talk about other things relating to sexual health access, social determinants of health, and really anything to do with health in general. So we're here to have a chat, have a discourse, a dialogue about important topics that affect our community. And thank you for tuning in, or if you're watching the recording.
Yeah, so let's get started. So as you all may know, Mpox has stopped significantly. The cases are pretty much 0 to none, which mean, more none, which is great, which means that we've done our part pretty much in order to help stop the spread of this virus. So kudos to all of us. But I want to talk about another virus that's been around for quite some time that I'm sure you are familiar with, which is HIV. It's still prevalent today. But great thing is, over the years, we've been able to come up with things that work in towards preventing the spread for individuals who are not HIV positive. So I'm not sure if a lot of you are familiar with PrEP, PEP, Apretude, or 211. So we want to segue towards that a little bit this time around, just because it's a great topic to talk about, and I feel like people need to be updated if they're not too familiar with any of those. So let's talk about PrEP. What's PrEP? It stands for pre-exposure prophylaxis. So it's for individuals who are HIV negative and vulnerable to getting HIV. And that is many ways. It's not just gay men. You can get it through sharing needles. If your partner is HIV positive, if you are sexually active. Those are just a few ways that for individuals who should be taking PrEP. Anybody can take it. It's not just for one person. And the pill you take once a day, regardless if you're having sex every day or not, it will take roughly about 7 to 20 days for the pills to be effective. And there are 2 pills that have been approved for the use of PrEP, and one of them is Truvada, which has been around for quite some time, and now we had Descovy. And everyone's different. So you can be taking Truvada or you can be taking Descovy. Just continue going to your doctor and get yourself regularly checked out. PrEP is safe if you aren't sure, but some people do experience some side effects, but you experience side effects with a lot of other things as well. Again, just monitor with your doctor and continue getting your checkups, because that's the only way you will know if you need to change something or if something's not working right. Just keep going to your healthcare provider. And just keep in mind that Descovy is new, and Descovy is not for people assigned female at birth. Fun fact, I didn't know that until I started reading into it. Who are at risk for HIV through receptive vaginal sex.
Right.
and you'd be going every 3 months. Get yourself regularly checked out, your bloods, your STI checks, just to ensure that you are still HIV negative and that PrEP is working for you. You know, PrEP reduces the risk of getting HIV by 99% as taken as prescribed. So that's pretty
Really
protective,
good.
like 99%. And if
It gives
everyone's
you
doing
big
it,
peace of mind.
yeah, it's yeah, exactly. So that's a little bit about PrEP on my end. Kevin, do you want to let the people know about another one?
Yeah, definitely. So I wanted to really quick segue into Apretude or injectable PrEP. It's fairly new. It was approved last year by the FDA. Um, there are some, you know, barriers when it comes to accessing injectable PrEP or Apretude just because of insurance covers, because it's fairly new. We saw the same thing with Truvada for PrEP. Same thing with Descovy for PrEP. When something is new, it takes some time for insurances to catch up. But basically, instead of taking a pill every day orally, you'd be getting an injection every 2 months. When you're first starting out, that may look different because you may need to come back a month to get another injection, and then every 2 months. But the great thing about injectable PrEP is that you don't have to take pills, right? You um, don't have to remember to take it. I am guilty of that. I forget to take my medication when I ever have medication that I need to take on a regular basis, such as PrEP. So Apretude is great if you forget about taking your medication. And we are starting to implement Apretude injectable PrEP with Whitman-Walker, which is really exciting. So as always, if you're interested, if you have any questions, you can reach out to us. You can call us at our main line, 202-745-7000. We also have our testing line for HIV and STIs, 202-797-4439. It's been pinned on the chat. You can find out more information on our website. But I also wanted to talk about something equally as important, which is PEP, or post-exposure prophylaxis, which is the idea of taking HIV medication after an exposure to HIV has occurred to prevent yourself from getting infected with HIV. Now, that is a treatment option that's time sensitive, so it has to be done within 72 hours. Obviously, the earlier that you can take PEP, the better. Um, and every hour counts, so the sooner the better. If you're prescribed PEP, you'll need to take it for a month or approximately 28 days. And so you can get PEP at, if you go to a hospital. You can also get it from Whitman-Walker Health. You can call our line, actually, 202-797-4439. Although we do have limited hours, we also have the DCPEP line that's available 24/7, 7 days a week as well. So that's also an option. And you can look that up. It's for DC residents. But if you're like outside of like regular doctor hours, the hospital, the ER might be your best bet. Um, so Tommy, not sure if you wanted to talk about 211, which has been making a lot of rounds lately, especially
I know.
because it's becoming more common, and it's there's a lot of interesting information out there about it.
Yeah. So 211 is pretty much like an on-demand PrEP. So it's for individuals who, don't want to take PrEP every day, take their pills, or get the injectable shots every other month when they're, coming in. So pretty much how it works is you'll be taking 2 pills 24 hours before you have sex. Then you take 1 pill 24 hour after the first dose, and then 1 pill 24 hours after the second dose. So these are for people if you know you're going to be having sex in 24-hour span, or you want to make sure you take it. For again, people who don't want to take pills every day or get a shot every other month. This is just that quick shot that's been working. Everyone is it's coming up. If you haven't heard, you'll be hearing about it fairly soon because it's something new that's effective and it's working and it's different, and it's just right then and there you can take your pills. And I don't think that you need to be come in for PrEP visits for it, if I'm not wrong. I don't know if you have to come in order to get prescribed. Do you? I don't know if you
You
know.
definitely do need to come and see a medical provider or
Okay.
your PC, get a prescription, and one thing we want to emphasize is that 211 may not be for everyone, and it's not yet approved in the US by the FDA. We're seeing places like in Europe where there's a lot of research going on, a lot of really meaningful data coming out from what's been happening overseas, but um, it's not something that's standard practice necessarily. But we just wanted to give you the information because it's shown to work, and for some folks it may be an option, right?
Yeah.
And always we recommend that you talk to a medical provider, schedule a medical appointment, and discuss these things. But I think for a lot of people, taking oral PrEP daily might be the safest option, right? Just because 211 can be very
Yeah.
circumstantial, and we always recommend that you consult with a medical provider first.
Yeah, so those are the exciting different ways one can prevent themselves from, getting the spread of HIV for individuals who are HIV negative. So hopefully that was a little informative for anyone who didn't know who's watching, because that's pretty awesome. They have different ways for, different lifestyles of people who choose for the safety of their health in different ways.
Absolutely. And reflecting back as I was thinking about this and going over our script that we have, it's so interesting how medicine has come a long way, the technology that we have, because I think for a lot of people, a long time ago, if you would have told them that there's a pill to prevent HIV, like that would have been, mind blowing in the sense that it's very
Yeah,
revolutionary. Now, even an injection, right? Like an injectable, like we're every day closer to being able to stop HIV transmission in the US and in the world. We have our mandate from ending the HIV epidemic, and lots of work going around from health centers and people in the public health field who are driving, things forward. And of course, always the community and allies who are advocating for us and for one another. But this is really powerful that we have different options. And so if you have any questions, if you don't have a primary care physician, if you're looking to establish medical care, Whitman-Walker is always accepting new medical patients. So you can call us at our main line 202-745-7000 or email us at appointments@whitman-walker.org, and establish yourself as a patient and ask your medical provider questions and see if PrEP is an option for you, right? One thing that I also wanted to point out is that being on PrEP, like it definitely gives you that peace of mind, right?
yeah,
Like even if you're wearing condoms, practice safe sex, which we still recommend, right? Because PrEP only prevents against the spread of HIV, not other
correct.
STIs like chlamydia, gonorrhea. But say the condom breaks or something happens, like you'll still get that protection as far as HIV is concerned. So that's something that a lot of people really like, having that extra peace of mind. And earlier during the year, Tommy, or I think it was last year, we were talking about some statistics about how Mpox has affected several individuals, especially those who are immunocompromised.
Mm-hmm.
Fortunately, we know that for people who are living with HIV, who may not be adherent or may not be linked to medical care, like those are unfortunately the individuals that suffer the most from, the lesions from Mpox, from what Mpox causes to your body and what it does to your skin, right? And it
Yeah.
makes sense because your immune system is weakened, right, because of HIV. So it's really important that, we circle back and talk about different prevention methods. And in this case, we talk about PrEP and talk about sexual health and what access to that looks like, so that, something like Mpox comes around and, if someone gets it, it's not going to be as
Yeah.
severe, right?
Yeah.
It's not going to be something that's going to be a life or death situation. And so we just wanted to take some time today to talk about PrEP because everything is sort of like connected, right?
Yeah, that's just
You
thinking that everything's connected.
definitely.
Everything like comes together at some point. They're connected, So yeah, I mean, going back to Mpox and like how COVID was, taking the measures you need to take to prevent yourself from getting those viruses could help you from prevention of maybe getting another one. So continue washing your hands, continue wearing condoms during sex and face masks around when you're around people. Continue talking to your sexual partners about their history, your history. Get yourself regularly checked out at your local healthcare provider. All of these different things all these different tools that you can use will help prevent the spread, whether it be a virus or an STI or anything that we've been having going on in these last like 3 years.
It's definitely a lot going on this last 3 years. It's been such a crazy timeline, and here we are in 2023 February, and it's like what's coming next, right? But the good thing is that we know what works, like you mentioned, practicing hygiene, washing your hands. We've been talking about, you know, if you're seeing sexual partners, washing them
Yeah.
sheets, right? Washing them bed sheets, that's key. And getting tested, right? Like once again, Whitman-Walker offers HIV and STI testing. You can also always ask your medical provider, if you have a medical provider, maybe when you go and get your annual checkup, to ask for HIV and an STI panel if that's not offered to you. And, you know, doing your due diligence when it comes to practicing self-care and staying healthy.
Yep. So I don't know if you wanna, we still have the Mpox clinics here in DC in different locations, Ward 2, 3, and 8, all ranging from like 10 a.m. to like 8 p.m.
Mm-hmm.
Just look at DC Health and you can find the websites, the times, and you can get yourself vaccinated because vaccination is important and it has proven to work. But I mean, other than that, everyone just continue staying safe, continue taking the measures you need to take in order to prevent the spread because we've been doing it. We've been doing great.
We've been definitely been doing great. So thank you, Tommy, for having me with you once again in this virtual space. And as always, we will see you around.
Have a good Thursday, everyone.
Happy Friday Eve.